Thank you. Thank you very much. I'm Dr. Mike McInnes. I'm one of the chief educators here at Doctors in Training, and I want to welcome you to this here solid anatomy video on the bones and ligaments of the pelvis. Wait, what? Are you serious? Pelvis? With a P? Man. I'll be back later on for some clinical correlations in the end of session quiz, but for now I'm going to turn it over to our primary lecturer, Dr. John Phelan.
Pelvis is the Latin word for basin. So when anatomists see a basin-shaped area on the body, they often refer to it as a pelvis. If you've watched the solid anatomy lecture on the posterior abdominal wall and viscera, you may recall the renal pelvis, which was the basin-shaped area in the kidney into which the renal calyces drained. The pelvis that will be discussed during this lecture is the large basin-shaped area in the lower part of the trunk of the human body. The bones of the pelvis, which are the sacrum and the paired os coxae, or hip bones, make up the pelvic girdle. If you've watched the first solid anatomy lecture on the upper extremity, you may recall from the discussion of the shoulder girdle that girdle means ring. Thus, the pelvic girdle may be thought of as the bony ring that protects the pelvic viscera. The shoulder girdle does not have to bear much weight unless you spend a lot of time walking on your hands, and thus is adapted for mobility. But a major function of the pelvic girdle is to transmit the weight of the upper body to the lower extremity, so its structure sacrifices mobility for weight-bearing ability. Thus, the bones of the pelvic girdle are more sturdy, thicker, and more tightly bound to each other with ligaments than are the bones of the shoulder girdle. An additional function of the pelvic girdle is to serve as an attachment point for muscles such as the rectus abdominis. Each hip bone is formed by three bones that fuse during development: the ilium, the ischium, and the pubis. All three bones contribute to the socket of the hip joint, which is called the acetabulum. There has undoubtedly been a moment in your life when you've looked at the acetabulum and blurted out, "That looks just like a vinegar bowl," much to the chagrin of your former friends and the relatives who subsequently disowned you. And indeed, the Latin translation of acetabulum is vinegar bowl. The ilium has an iliac crest superiorly that ends anteriorly and posteriorly in the anterior and posterior superior iliac spines, respectively. There are anterior and posterior inferior iliac spines as well. Just inferior to the posterior inferior iliac spine is the greater sciatic notch. The iliac fossa on the medial side of the wing-shaped ala of the ilium is filled by the iliacus muscle of the posterior abdominal wall. Also on the medial side of the ilium, the curved arcuate line is found at the border between the ala and the body of the ilium. The ear-shaped auricular surface on the medial side of the ilium, superior to the greater sciatic notch, is the area of articulation between the ilium and the sacrum. The ischium has a ramus, which is Latin for arm, and a very thick body. Protruding from the body are a tuberosity, which bears the weight of the body in the seated position, and a spine. Between the spine and the tuberosity is the lesser sciatic notch. Two ligaments run between the sacrum and the ischium: the sacrotuberous ligament, which attaches to the ischial tuberosity, and the sacrospinous ligament, which attaches to the ischial spine. With these two ligaments in place, the greater and lesser sciatic notches become the greater and lesser sciatic foramina. The pubis has a superior ramus and an inferior ramus with a body between them. The symphysial surface on the medial side of the body is where the pubis articulates with the fibrocartilaginous disc of the pubic symphysis, which is a secondary fibrocartilaginous joint, hence the name symphysis, between the left and right hip bones. On the superior ramus, just lateral to the pubic symphysis, is the pubic tubercle. The area on the superior edge of the superior ramus, between the symphysis and the tubercle, is the pubic crest. The flat area on the superior edge of the superior ramus, lateral to the tubercle, is the pecten pubis, or pectineal line, where the pectineus muscle originates. The inferior pubic ramus joins the ramus of the ischium to form the ischiopubic ramus. The ischiopubic ramus, the superior ramus of the pubis, and the body of the ischium surround the obturator foramen.
Welcome back. Dr. Phelan's already mentioned several anatomical points or landmarks which have important clinical significance. I want to take a minute here and identify some of these points and explain why they're clinically important. So let's start with the iliac crests, which are sometimes colloquially referred to as the hip bones. Now, one of the reasons you want to keep the iliac crests in mind is that they're used to help select a spot for a lumbar puncture. So you identify the most superior part of the left and right iliac crest, and you draw an imaginary line between them on the back. And where this imaginary line crosses the midline is the point at which you're going to find the intervertebral space between L3 and L4. That's the ideal spot to aim for in a lumbar puncture. So you want to make sure that you're low enough to where you're not going to hit the spinal cord with your needle. Now, another clinically significant landmark is the anterior superior iliac spine, or the ASIS. So this landmark is also palpable right at the end of the iliac crest anteriorly. And the ASIS comes into play when you're looking for McBurney's point. Now, you may have heard of McBurney's point before. It's the area that's classically going to be painful in a patient with appendicitis. So if you draw an imaginary line from the umbilicus to the anterior superior iliac spine, McBurney's point is about 2/3 of the distance from the umbilicus. So if you palpate over this area in someone who you suspect has appendicitis, you might be able to elicit some pain. So be aware of that. All right, two more landmarks before we get back to the lecture: the ischial spine and the sacrospinous ligament. These two structures become important when you're performing a pudendal nerve block. So the pudendal nerve is a nerve that can be anesthetized or blocked to minimize the pain of a vaginal delivery. So to numb this nerve, you can identify the ischial spine with your fingers by working your way along the sacrospinous ligament to the ischial spine. And the pudendal nerve passes right by this point. This is where you're going to stick the needle to administer anesthesia. So this answers the questions in your study guide. The first one there is the iliac crests, which are going to help you find the L3, L4 intervertebral space in order to perform that lumbar puncture. Then the next one is McBurney's point is 2/3 of the way from the umbilicus and a line drawn from the umbilicus to the anterior superior iliac spine. And then the landmark used to identify the site for a pudendal nerve block is the ischial spine. All right, let's get back to the lecture.
The 5 fused sacral vertebrae compose the sacrum. Articulating with its tapering inferior end, or apex, are the 4 fused coccygeal vertebrae that compose the coccyx. The anteriorly projecting edge of the body of S1 is the sacral promontory. On the superior surface of S1, which is the base of the sacrum, the flat, wing-shaped ala extend laterally from the body. If you're wondering if you've heard another structure named ala once in this lecture already, you did. Ala is the Latin word for wing, and anatomists like to name wing-shaped structures in the body ala. Moments ago, we spoke of the ala of the ilium. Here, we are describing the ala of the sacrum. At the level of the S1 and S2 segments, there is a lateral auricular surface that mirrors the auricular surface of the ilium. This is the articular surface for the sacroiliac joint that will be described shortly. The centrally located sacral canal is the continuation of the vertebral canal and houses the cauda equina. The sacral canal opens into 4 anterior and 4 posterior sacral foramina that allow passage of the sacral spinal nerves. The sacral canal ends inferiorly in the sacral hiatus, a gap formed by the absence of the laminae and spinous processes of S4 and S5. The remnants of the inferior articular processes on the inferior margin of the hiatus form the sacral cornua, which can be palpated and thus aid in the estimation of the hiatus when administering epidural anesthesia. The superior pelvic aperture, or pelvic inlet, separates the greater, or false, pelvis from the lesser, or true, pelvis. The false pelvis is the area between the ala of the ilia and is actually part of the abdomen. Surrounding the superior pelvic aperture is the pelvic brim, which is composed of the sacral promontory, the ala of the sacrum, the arcuate line of the ilium, the pecten pubis, the pubic crest, and the pubic symphysis. The pelvic brim is oriented obliquely in anatomical position. The inferior pelvic aperture, or pelvic outlet, separates the true pelvis from the perineum, which will be defined in a moment.
Welcome back again. So let's talk a little bit about the difference between the male and the female pelvis. Now, men and women are different on a lot of levels, but especially when it comes to the bony pelvis. So in men, the pelvic bones are going to be thicker and heavier. The false pelvis is deeper. The pelvic inlet is more heart-shaped, and the pelvic outlet is smaller. But in women, the pelvis is adapted for childbirth, so the bones are thinner and lighter. The false pelvis is shallower. The pelvic inlet is more rounded or oval-shaped, and the pelvic outlet is larger. Then also, the subpubic angle is wider in the female pelvis. It's greater than 80 degrees compared to an angle of less than 70 degrees in men. Now, 40 to 50% of women have what we call a gynecoid pelvis, with a pelvic inlet that is notably rounder and wider than we see in the male pelvis. But about 30% of women have a more heart-shaped pelvis inlet, similar to the male pelvis. We call this an android pelvis. About 20% of women have what's called an anthropoid pelvis, which is an oval pelvic inlet with the greatest diameter oriented in the anterior-posterior direction. The anthropoid pelvis is even more common in black women. About 40% of black women have this anthropoid pelvis. Then a very small percentage of women, 2 to 5%, have what we call a platypeloid pelvis, an oval pelvic inlet with the greatest diameter oriented laterally. Then for the next question, the smallest diameter of the pelvic inlet that a fetus has to pass through is called the obstetrical conjugate. This is the diameter from the midpoint of the pubic symphysis to the sacral promontory, which averages 10 to 11 centimeters. All right, let's get back to the lecture.
The inferior pelvic aperture is bordered by the pubic symphysis, the ischiopubic rami, the sacrotuberous ligaments, and the sacrum and the coccyx. Let's take a moment to consider what we've learned about the orientation of the bony pelvis. Say you're standing in the lesser pelvis and you want to leave. If you leave through the superior pelvic aperture, you go to the abdomen. At that point, if you are between the ala of the ilia, you are in the false pelvis. But if you are anterior to them, you are not. If you leave through the obturator foramen, you go to the medial thigh. Leaving through the greater or lesser sciatic foramina places you in the gluteal region under the gluteus maximus. Finally, if you leave through the inferior pelvic aperture, you go to the perineum. The perineum is a diamond-shaped area bounded by a pair of lines drawn from the ischial tuberosities to the pubic symphysis anteriorly, and by a pair of lines drawn from the ischial tuberosities to the tip of the coccyx posteriorly. A line joining the ischial tuberosities divides the perineum into the urogenital triangle anteriorly and the anal triangle posteriorly. Recall from the solid anatomy lecture on the thoracic wall that the inferior thoracic aperture was filled by the diaphragm muscle. Filling the inferior pelvic aperture is a group of muscles named the pelvic diaphragm. If you pass through the diaphragm from the thorax, you enter the abdomen. If you pass through the pelvic diaphragm from the true pelvis, you enter the perineum. The hip bones and sacrum are involved in several joints. The hip joint between the acetabulum and the head of the femur will be discussed during the solid anatomy lectures on the lower extremity. The lumbosacral joint between the bodies of L5 and S1 has the same features as the other symphysial joints between the bodies of the vertebra that were discussed in the solid anatomy lecture on the deep back and spinal cord. In addition to an intervertebral disc and the longitudinal ligaments, the lumbosacral joint is further strengthened by an iliolumbar ligament connecting the transverse process of L5 to the iliac crest. Zygapophyseal or facet joints with the same characteristics as the facet joints of the vertebral column are found between the superior articular processes of the first sacral segment and the inferior articular processes of L5. The symphysial surfaces of the right and left pubic bones articulate in the midline at the pubic symphysis, a secondary cartilaginous joint. The symphysial surfaces are covered with cartilage that binds to a central fibrocartilaginous disc. A series of strong ligaments between the pubic bones stabilize the joint, which resists separational forces imposed by the weight of the body. Despite its strength, this joint may become dislocated during childbirth, a condition clinically referred to as diastasis symphysis pubis. The sacrococcygeal joint, between the apex of the sacrum and the first coccygeal segment, is yet another secondary fibrocartilaginous or symphysial joint. It has a thin intervertebral disc and is reinforced by sacrococcygeal ligaments. It often fuses later in life, but until then it may be modestly flexed and extended, which is an important action during childbirth. The auricular surfaces of the ilium and the sacrum, both of which are covered by a thin layer of cartilage, articulate with each other to form the sacroiliac joint. It is a synovial joint with a fluid-filled synovial capsule reinforced by strong, thick anterior and posterior sacroiliac ligaments. Even though the sacrospinous and sacrotuberous ligaments attach to the ischium rather than the ilium, these ligaments lend further support to the sacroiliac joint by resisting rotational forces on the sacrum with respect to the ilia. The weight of the body is transmitted from the axial skeleton to the appendicular skeleton at this joint, so its structure sacrifices mobility for weight-bearing ability.
So that covers the bones and the ligaments of the pelvis. Now I want you to pause the video and answer the end of session quiz questions. Then we're going to go through those answers together. All right, first question. What are the three bones that fuse during development to form the hip bone? Well, the first one is the ilium, or sometimes you'll hear it pronounced the ilium. Then you have the ischium and also the pubis. Next, what's the area of the ischium that bears the weight of the body during sitting? That's called the ischial tuberosity. Next, what separates the greater and lesser sciatic foramen? It's the sacrospinous ligament. The next one, in addition to the sacrospinous ligament, what other ligament helps form the greater and lesser sciatic foramen? That's the sacrotuberous ligament. The next one, does the male or female pelvis have a greater subpubic angle? We said that's the female pelvis. Next, what are the four structures used in drawing the boundaries of the perineum? Well, the area of the perineum is bounded by a pair of lines drawn from the ischial tuberosities to the pubic symphysis and a pair of lines drawn from the ischial tuberosities to the tip of the coccyx. Next, what's the most common type of female pelvis? It's the gynecoid pelvis. Next, what's the shape of an android pelvis? Remember we said that was heart-shaped. And then what's the obstetric conjugate? That's going to be the smallest diameter of the pelvic inlet through which a fetus must pass. And it's the diameter from the midpoint of the pubic symphysis to the sacral promontory. Last one, in a person standing upright, what bony landmark of the pelvis lies in the same vertical plane as the anterior superior iliac spine? That's the pubic tubercle. All right, we're almost finished. Now we have some images for you to label. So being able to label these images in a time setting is going to help you perform well on your practical exam. So go ahead and label these images, and then we'll be finished. Thanks.